Everyone, I'm John Miller, Creative Director at Compass, back with our head coach, Samantha Jones. And Sam, we're talking about right now as we get back into seeing a lot of patients, the importance of financial arrangements and agreements.
I mean, it's critical to the success of the practice. I mean, that's the revenue that's coming through. So the longer that we put off collecting from our patients, that puts space between our profitability. And there's no reason why we shouldn't be collecting date of service. We don't go to the grocery store and walk out with a gallon of milk without paying.
Right.
Dentistry is no different. We should have the expectation and give the expectation that patients should be paying when they leave as well.
My dentist, my hygienist said, boy, we really hate talking about money. It's an uncomfortable conversation. So in the Compass program, we actually talk about the internal study club. And this is something you want to do during a meeting every now and then. And how does that work?
Well, essentially what it is it's a little mini study club that you do with your practice. Doctors, what you would do is just bring a couple of cases in and walk your team through what are you seeing on the x-rays or the IOCs. How are you noting what you're seeing in the chart? What language are you using with your patients during that diagnostic conversation? And then even explaining to your team members how the procedure works. What does the process of doing a root canal look like? What are the implications of not doing a root canal or a crown that has really deep decay? What are the implications for that for patients? The reason we do this is because it provides education for your team to understand your diagnostic philosophy and to gain confidence around the value of the dentistry that you're providing in your practice.
So, when a patient says, well, can't we just put a filling in it and be done with it? And you can more confidently explain to the patient.
That's right. You can say, this is too large. That would, if we put a filling in there, Mrs. Jones, that tooth wouldn't be very strong. It would become brittle. So putting a full coverage crown on there is going to give that tooth strength and sustainability.
Right. So the first part of collecting is explaining the value of what you're doing.
Right.
And then the second part would be a strong financial agreement, which we also preach in the Compass program. You have to have that. We actually have that sheet right here. And the first part of that is a policy that details everything. What's in that policy, basically?
It just shares with the patients the expectations that we have around them paying their portion of their bill. And so it just really spells out how we will do that and what they can expect from us in terms of how that transaction will take place.
And then it moves on down the sheet where we can actually put in the tooth number, the area of concern.
Yeah, that's where the administrator can look really smart because they've done internal study clubs and they can actually have brief conversations around the clinical terminology and everything that's been talked about in the operatory with the patient.
And that way they know, well, you're going to owe $800 on the date of service.
Right.
You're going to get some resistance there, aren't you, sometimes?
Sometimes it happens. And I think that part of one of the qualities that a financial coordinator or a treatment coordinator needs to possess is the ability to recognize and observe the roadblocks that are in front of our patients when we're talking about money and not being afraid to speak to those. Say something like, Mrs. Jones, I noticed there's hesitation around this. Can you tell me more about that? And then listen, ask her what the roadblock is from her being able to take care of herself with this particular treatment. And once we do that, once we identify what the roadblock is, we then can be prepared and ready to present some options for that patient to be able to take care of themselves in a way that's comfortable for their budget. And you should have some options in place, whether that's an outside financing company that you use or an in-house payment plan that you have. Maybe it's an in-house membership that you offer. So it's important to really think through some of the obstacles that you've experienced and create a solution around that so that you can bring your patients to a yes.
Right. We say down in the bottom of that, we accept cash or checks. We can accept Visa. We have company called Care Credit that can help you with this stuff, presenting more options. Now, one more that you're seeing here pop up, especially you were telling me was Blue Cross Blue Shield, especially in some of your practices, they want to directly reimburse the patient.
And it doesn't happen often, but it does happen. And that can be a pretty big roadblock for some patients because in their mind, they're like, I have insurance, I want to use it. But we also expect to be compensated on the day of the appointment. And so it's a tricky one, but we've thought of a solution for that, John.
Right, and that actually involves one more form. That's a very simple form. We've got it right here, and we'll send this to anybody. If you want to email us at info@compassdps.com, we'll send you this form. But what does this do? It essentially allows you to hold a credit card.
Right. So for those patients who have an insurance company that assigns the benefit to the patient and not the provider, if they weren't able, if the roadblock was they don't want to pay up front, then we would provide the option of holding their credit card for 30 days. That gives them time to wait for their reimbursement and get reimbursed by their insurance company. And then it gives us the peace of mind that we've already gone through the process of holding on to that credit card. So all we have to do is process the card for payment. It's very simple, but it's just a layer of accountability that keeps us from, number one, having to send out a $7.35 statement and just being able to efficiently collect payment.
Remember, when we send out statements, it costs a lot of money, more than $7. You said the whole process of sending out a statement is expensive. So we want to do whatever we can to collect on that. I keep referencing our book here. This is our Compass Playbook, just back from the printers. And we do discuss all of these things in here. If you sign up for the program now, which you can do at www.compassdps.com, we're going to send you this book for a limited time. We're just making these available. So if you sign up for our video program where we discuss the Internal Study Club, where we discuss financial agreements and arrangements with patients, it's also got those forms in there that show you exactly how to create this. You can take that form, put your own logo on it, and basically make this your own and learn exactly how to do it with every patient, every time. So sign up for the Compass program. We're going to give you that book. We're just going to send it right out to your practice. So let's wrap it up here. In conclusion, it's about knowledge, the Internal Study Club.
Yep. It's about having a plan. You have to have a plan in place, and you've got to think of it in multi-levels. So you've got to think about all of the obstacles that you've heard before from your patients about paying, and have a plan for it, have a strategy. Last thing too, John, is I just want to make sure that if you are offering holding a credit card or something like that as an option in your practice, you just want to make sure that you have the proper secure payment portals to do that, so that you're so that you're remaining in compliance with that process. So many credit card companies offer that, so you should have it if you have a credit card terminal of some sort.
Okay. Make sure they know of the value of the treatment. Make sure you're clear in your financial agreements, and make sure you give them options to pay.
That's right.
Very important as everybody gets back to work here.
Absolutely.
Sam, thanks again for your time.
Yeah,
thank you guys for watching, and we'll see you next time.